Hey, it is me. I am here to give an update on how things are going. I feel like all of my friends and family must have had their spidey senses tingling because I've had so many people reach out the past month or so to see how I'm doing. Spoiler alert, I'm not doing well. Okay, so here's like the backstory of like all the other things that have been going on. So I'm still doing the endocrine therapy and I'm still doing the targeted therapy. So the targeted therapy is an oral, it's basically like an oral chemo, you know, it's like a chemo light. So those things have tons of side effects and make me feel like garbage, but I am able to live life and function on them. I do understand why people don't stay on those because it is rough. It is so rough. I don't like it. But I do have the option to downgrade to other types of endocrine therapy. So most people take something called tamoxifen, who, like most, ladies who have hormone positive breast cancer take something called tamoxifen. That is a backup option because it has way less intense side effects, or some people don't even experience anything significant. However, it's not what's recommended for me. So I'm trying to stick with what is recommended because I want to be here for my family. So that's what I'm trying to do. Taking it day by day, and they kind of just like give you medications to help with the side effects of the primary treatment and kind of hope for the best. So we'll see how it goes. So far I'm able to continue on. Also have lymphedema from surgery. So surgery, they removed a bunch of lymph nodes, and because of that, my lymphatic system doesn't function well in my left arm, and I have swelling and pain, and I also have nerve damage, so my left arm just like doesn't do well, and it's very limited in its range of motion too. So there's pain and discomfort that comes with that. But I have tools to manage that. I have compression sleeve, compression pump, and I went to a physical therapist who helped me figure out how to do all the things to help it. So we've been learning how to manage that. I do think that the summertime heat might have made it worse. And I also think maybe one of my medications might have caused like water retention because it made me gain a bunch of weight, and then my arm also wasn't doing well. So I don't know. That's my theory. We'll see. Yeah, so those are all the things that have been just like happening in the background. Also, a couple of times I had symptoms that I thought were fine, and then my oncologist was like, actually, this might be cancer. So they did biopsy and stuff. Anyway, all of it's fine, but what an emotional roller coaster. It's just a lot to deal with. All right, so that's like the past 6 months, right? And then the past month, I've had some health things come up that are red flags for a possible autoimmune disease. So I had some eye things happening, and that sent me to the ER. They did a CT of my head to rule out tumors, aneurysms, clots, all that stuff, and it was fine. I wish I could show you pictures without like grossing you out because my eye looked crazy. It was crazy. But I thought, this is probably a fluke thing. Well, then a week later, I had chest pain, and that chest pain didn't go away, and it got really intense that they did another CT of my chest this time, and I don't have anything. That's what they were worried, that I might have a tumor in my lungs. But I don't, so that's great. But then those two things together are red flags, like not a good thing. I also have a bunch of other side effects that I kind of chalk up to cancer treatment, but they do overlap with things that would be an autoimmune issue, joint pain, fatigue, all that kind of stuff. So I have an appointment with the rheumatologist at the end of the month, and we will see. Yeah, I don't know, have no idea. In the meantime, I am excited for a lot of things coming up. We have plans for a great school year with the kids, a great fall time. My baby is doing so well. She's growing and precious as can be. So we have a lot of wonderful things happening alongside a lot of like little things happening. But we can live with the tension of both of those. So that's the update, guys. That's the update. Your prayers are appreciated. I have sent the bat signal out to my close friends and family members to please be praying for me, that my body would get it together because we got things to do. So I appreciate you guys, and I will talk to you later. Bye.